Tuesday night at 2:15 a.m., the emergency department at St. Mary's Hospital was in chaos. "Where's the cardiologist? We're losing him! Someone help!" Nobody paid attention to the 68-year-old janitor who set down his trash cart and walked purposefully toward the dying patient. Nobody knew that Samuel Chen had spent 25 years as a cardiac surgeon in military hospitals from Vietnam to Korea. That night, the identity he'd hidden for 6 years was about to surface to save a life. Welcome to Sacrifice Stories. Before we dive into this incredible story of hidden expertise and life-saving skills, tell me in the comments what city you're watching from today. And if you believe stories of quiet heroes deserve to be heard, hit that subscribe button to support our mission. These stories matter more than you know. Samuel Chen arrived at St. Mary's Hospital every night at 11 p.m. sharp, just as he had for the past 6 years, 2 months, and 14 days. He could tell you exactly because that's how long it had been since he'd traded his surgeon's scrubs for a janitor's uniform, his operating room for hospital corridors, his scalpel for a mop. At 68, Samuel was the kind of employee hospitals barely noticed. Average height, slight build, graying hair always neatly combed, and the sort of quiet efficiency that made him invisible to everyone except for the few night shift workers who appreciated his reliability. He knew every floor plan by heart, every supply closet location, and exactly which elevators made that concerning grinding noise that meant maintenance would be needed soon. What the hospital staff didn't know was that Samuel Chen had spent 25 years as one of the military's most skilled cardiac surgeons, working in MASH units, field hospitals, and military medical centers in places that didn't appear on civilian maps. He'd performed heart surgery under enemy fire, operated by candlelight during power outages, and saved more lives than most doctors see in their entire careers. His transition to civilian life was voluntary, at least officially. After a quarter-century of high-stress medicine in war zones, Samuel had wanted nothing more than a simple job where the biggest crisis was a spilled coffee in the waiting room. St. Mary's Hospital in suburban Michigan was perfect, busy enough to be interesting, quiet enough to be peaceful, and medical enough to feel familiar without the life-or-death pressure. The irony wasn't lost on him that he was cleaning the same type of floors he'd once operated above, emptying trash cans in rooms where he'd once saved lives. But there was a strange comfort in the routine, mopping corridors at 2 a.m. while the hospital slept, ensuring everything was clean and ready for the morning shift, being useful without being responsible for anyone's survival. His co-workers on the night shift knew him as Reliable Sam, the janitor who always had a kind word for the stressed nurses, who somehow always appeared when heavy equipment needed moving, and who never complained about working holidays or weekends. The few who tried to engage him in conversation found him polite but private, friendly but never personal. What they couldn't see was that Samuel's apparent aimlessness during his rounds was actually a deeply ingrained habit of medical assessment. When he cleaned the emergency department, he automatically noted which beds had the best access for resuscitation equipment. When he mopped the surgical corridors, he observed which rooms had optimal lighting for emergency procedures. 25 years of military medicine had trained him to constantly evaluate his environment for medical contingencies. Samuel lived alone in a small apartment 15 minutes from the hospital, drove a reliable Toyota Camry, and spent his days reading medical journals he still subscribed to and tending a small garden behind his building. It was the kind of life he dreamed about during those exhausting nights in military hospitals when dawn seemed uncertain and the next casualty was always arriving. The pay was a fraction of what he'd earned as a military surgeon, but Samuel had his pension, and more importantly, he had peace. No more 3 a.m. emergency surgeries, no more making life or death decisions under impossible conditions, no more watching young soldiers die on his operating table despite his best efforts. Tuesday nights were typically quiet at St. Mary's. The weekend rush was over and the midweek medical emergencies hadn't yet begun. Samuel had already cleaned the maternity ward, restocked supplies in 3 different departments, and was working his way through the emergency department when he heard the commotion. At 2:10 a.m., the emergency department's automatic doors burst open as paramedics rushed in with a 35-year-old man experiencing what appeared to be a massive heart attack. Samuel paused in his mopping to watch the controlled chaos that always accompanied critical cases, something he'd seen thousands of times from a very different perspective. Male, 35, found unconscious at home by his wife, the lead paramedic reported to Dr. Martinez, the emergency physician on duty. Possible MI, vitals are unstable, he's been down for at least 5 minutes. Samuel continued cleaning, but his trained eyes automatically assessed what he was seeing. The patient's color was wrong, a grayish pallor that indicated poor circulation. His breathing was labored and irregular. Most concerning was the rhythm on the heart monitor. Ventricular fibrillation, a pattern Samuel had seen too many times to count. Dr. Martinez was competent, but she was an emergency physician, not a cardiologist. She began the standard protocols, IV access, oxygen, and cardiac medications, but Samuel could see what she couldn't, the subtle signs that this wasn't a typical heart attack. The patient's age, his body habitus, the specific pattern of his symptoms all pointed to a more complex condition that required immediate surgical intervention. "Where's Dr. Patel?" Dr. Martinez asked, referring to the hospital's chief cardiologist. "He's at home, 20 minutes out," replied Janet, the head night nurse. "Dr. Kim from cardiothoracic is on call, but she's in surgery at University Hospital, at least an hour away." Samuel watched as the patient's condition deteriorated. His heart rhythm was becoming increasingly erratic, and despite the medications and electrical cardioversion attempts, he wasn't responding to treatment. In a military hospital, Samuel would have had this patient in an operating room within minutes. Here, they were following civilian protocols that prioritized stabilization over immediate surgical intervention. The problem was, this patient didn't have time for protocols. "We're losing him," Dr. Martinez said, a note of desperation creeping into her voice. "Janet, get Dr. Patel on the phone again. We need someone here now." Samuel found himself moving closer to the trauma bay, his mop forgotten. From his position, he could see the monitor clearly, and what he saw made his blood run cold. The patient was developing the exact pattern of cardiac dysfunction he'd seen in young soldiers who'd been exposed to certain battlefield conditions, a specific type of cardiac injury that civilian doctors rarely encountered, but that he'd treated dozens of times. Without the right intervention, and soon, this man would die. "His pressure's dropping," announced Mike, the emergency technician monitoring vitals. "BP is 70/40 and falling." Dr. Martinez was doing everything right according to emergency protocols, but Samuel could see that standard treatments weren't addressing the root problem. The patient needed a specific type of cardiac intervention, a procedure that most civilian cardiologists would only read about in textbooks, but that Samuel had performed so many times, it was automatic. The man's wife had arrived and was standing in the hallway, clearly terrified but trying to stay out of the medical team's way. She was young, probably early 30s, and Samuel could see a child's car seat visible through the waiting room window where she'd apparently rushed from her car. "Someone help!" Dr. Martinez called out, frustration evident in her voice. "We need a cardiologist here now." That's when Samuel Chen stopped being a janitor and became what he'd been trained to be for 25 years, a doctor who couldn't stand by and watch someone die when he had the skills to save them. He approached the trauma bay, moving with the quiet confidence of someone who belonged there. "Excuse me," he said softly to Dr. Martinez. "Not now," she replied without looking up, focused entirely on her patient. "Doctor," Samuel said, and something in his tone made her turn. "Sir, you need to step back. This is a restricted area." "I'm a cardiac surgeon," Samuel said quietly, "and I think I can help." The entire trauma bay fell silent for a moment. Dr. Martinez looked at him with confusion, then skepticism. "You're a janitor," she said.
I'm also a doctor. 25 years, military cardiac surgery. That patient has a condition I've seen before, and he's going to die unless someone intervenes in the next few minutes. Dr. Martinez glanced at the monitor, then back at Samuel. The patient's condition was clearly deteriorating, and her options were running out. "What kind of condition?" she asked. "Cardiac tamponade with paradoxical physiology, probably secondary to a small vessel rupture. You can't fix it with medications or external cardioversion. It requires immediate pericardial drainage and possibly emergency surgical repair." The specificity of his diagnosis, delivered with calm authority, made everyone in the trauma bay pause. This wasn't the voice of a confused janitor. This was the voice of someone who knew exactly what he was looking at. "Janet," Dr. Martinez said to the head nurse, "check his badge." Janet looked at Samuel's hospital ID. "Samuel Chen, Environmental Services." "Sir, I appreciate that you want to help, but that man has minutes to live," Samuel interrupted, pointing to the monitor. "Look at his pressure. Look at his rhythm. I've performed this procedure hundreds of times. You can verify my credentials later, but right now he needs help." Dr. Martinez looked at the deteriorating vitals, then back at Samuel. It was one of those moments that define careers. Trust an unknown quantity, or watch a patient die while following protocol.
"What's your name?" Dr. Martinez asked. "Dr. Samuel Chen, Colonel, retired, U.S. Army Medical Corps, 25 years cardiac surgery, specializing in battlefield trauma and emergency cardiac repair." The title and specificity of his background made Dr. Martinez pause. She looked at Samuel more carefully, seeing for the first time not a janitor, but a man who carried himself with the quiet authority of someone accustomed to making life or death decisions. "Janet, can you verify any of this?" "Dr. Martinez," Samuel said urgently, "verification takes time. Look at your patient." The monitor was showing the patient in extremis. His blood pressure had dropped to barely measurable levels, and his heart rhythm was becoming increasingly chaotic. "If you're wrong about this," Dr. Martinez said, "if you're not who you say you are, then you can have me arrested after the patient is stable. But right now he's dying from something I know how to fix." Dr. Martinez made the decision that would later be studied in medical ethics classes. She stepped aside. "What do you need?" Samuel moved to the bedside with practiced efficiency. His hands, which had been pushing a mop minutes earlier, now moved with the precision of a surgeon as he quickly examined the patient. "I need a pericardiocentesis kit, emergency surgical instruments, and someone to assist," he said, his voice taking on the calm authority of a man who'd commanded operating rooms under fire. "I need you to monitor his vitals and call out any changes. Dr. Martinez, if you're willing to assist, I need you to maintain airway support and be ready to push medications on my orders." "What exactly are you going to do?" Dr. Martinez asked as she moved into position. "There's fluid compressing his heart. It's preventing proper cardiac filling and output. I'm going to drain it, then assess for any structural damage that needs immediate repair." As he spoke, Samuel's entire demeanor had transformed. Gone was the quiet janitor. In his place was a confident surgeon who radiated competence and authority. His movements were economical and precise, his voice calm but commanding. "Janet, has someone contacted the patient's family about consent? His wife is here, but there hasn't been time. Get her consent for emergency cardiac intervention," Samuel said as he prepared the sterile field. "Explain that without this procedure, he won't survive." Within 2 minutes, Samuel had transformed the trauma bay into an impromptu cardiac procedure suite. His hands moved with the muscle memory of thousands of procedures as he positioned the ultrasound probe to guide his intervention.
"There," Samuel said. pointing to the ultrasound screen. "You can see the fluid collection around the heart. That's what's killing him." Dr. Martinez, despite her shock at the situation, found herself drawn into the procedure. Samuel's competence was undeniable, and his explanation made perfect clinical sense. "Beginning pericardiocentesis," Samuel announced, as he positioned the needle with ultrasound guidance. His hands were steady despite his age, moving with the confidence of someone who'd performed this procedure in far more challenging conditions than a well-equipped emergency department. "Got it," he said, as dark fluid began flowing into the collection syringe. Almost immediately, the patient's blood pressure began to improve. "Pressure's coming up, 90/60 and rising." "Good," Samuel said, continuing to drain fluid while monitoring the ultrasound. "But we're not done yet. There's a small tear in the pericardium that's going to need attention." As he worked, Samuel explained each step to Dr. Martinez and the nursing staff, turning the emergency procedure into an impromptu teaching session. In military medicine, we see this pattern occasionally in blast injuries or high-velocity impacts, he said while preparing additional instruments. "The key is rapid recognition and immediate intervention. Most civilian physicians never encounter it because it's relatively rare outside of combat zones." Within 15 minutes, Samuel had successfully drained the pericardial fluid and temporarily repaired the small cardiac defect. The patient's vital signs had stabilized, and his heart rhythm had returned to normal. That should hold him until the cardiothoracic surgeon arrives. He'll need definitive surgical repair within the next few hours, but he's stable now. The trauma bay was silent except for the steady beeping of the cardiac monitor, now showing a normal rhythm and stable vital signs. Dr. Martinez looked at Samuel with a mixture of amazement and confusion. "Who are you, really?" "Exactly who I said I was," Samuel replied, beginning to clean up the procedure area with the same methodical care he'd shown as a janitor. But that was a long time ago. Chapter 6. Verification and Recognition. Janet had been making phone calls during the procedure, and she approached Dr. Martinez with a printout. "I called the Medical Licensing Board and the Veterans Administration. Dr. Samuel Chen, Colonel, U.S. Army Medical Corps, retired, board certified in cardiac surgery, specialized in trauma and emergency cardiac repair. 25 years of active service, multiple commendations, retired 6 years ago." Dr. Martinez read the information, then looked at Samuel, who was systematically disposing of medical waste and organizing the instruments he'd used. "Dr. Chen, why are you working as a janitor?" Samuel paused in his cleanup and considered the question. "Because I wanted quiet life. Because I was tired of making life or death decisions. Because I thought I was done saving lives. And now? Now I remember why I became a doctor in the first place." Dr. Patel, the hospital's chief cardiologist, arrived 20 minutes later to find his patient stable and a full report of the emergency procedure waiting for him. After reviewing Samuel's work and the patient's current condition, he sought out the mysterious surgeon. "Dr. Chen, what you did tonight was textbook perfect. I couldn't have done it better myself, and I certainly couldn't have done it faster." Samuel was back to mopping the corridor outside the emergency department, having returned to his regular duties after the crisis passed. "Thank you," Samuel replied quietly. "I have to ask, why didn't you ever mention your background? We could have used someone with your skills on our medical staff." "I was retired," Samuel said simply. "I am retired. But tonight someone needed help and I was the only one available who could provide it." By morning, word of the night's events had spread throughout the hospital. Samuel arrived for his next shift to find Dr. Jennifer Walsh, the hospital's chief of staff, waiting for him in the Environmental Services office. "Dr. Chen, I think we need to talk." Samuel hung up his jacket and reached for his cleaning supplies. "I'm not sure what there is to discuss." "We'd like to offer you a position on our medical staff. Emergency cardiac surgery, consulting privileges, whatever arrangement would work for you." Samuel paused in gathering his equipment. "I appreciate the offer, but I'm happy with my current position." Happy cleaning floors when you could be saving lives? I saved a life last night while cleaning floors, Samuel pointed out. Position titles don't determine value. Dr. Walsh studied him carefully. May I ask why you left medicine? Samuel was quiet for a moment, considering how much to reveal. 25 years of military medicine takes a toll. I saw too many young people die despite my best efforts. I wanted to do something useful without the weight of life or death responsibility. But last night was one person, one procedure, one chance to help, not a never-ending stream of casualties where you know you can't save them all. You could help establish our trauma cardiac program, train other doctors in the procedures you know, share your expertise. Samuel resumed organizing his cleaning cart. Dr. Walsh, I appreciate what you're trying to do, but I've found my place here. I'm useful, I'm content, and I'm at peace with my choices. What if we offered a hybrid position? Part-time consulting, no regular hours, just available for emergencies like last night. What would happen when I'm not here? When someone needs help and the janitor is actually a cardiac surgeon? The patient's wife wants to thank you. That's not necessary. She says her husband is the father of 3 children. The youngest is only 2 years old. Samuel stopped working and looked at Dr. Walsh directly for the first time in their conversation. What's his prognosis? Full recovery expected. Dr. Patel says without your intervention, he would have died within minutes. There's no question you saved his life. Samuel nodded and returned to his preparations. Then that's thanks enough.
Despite Samuel's preference for anonymity, the patient's wife, Maria Rodriguez, waited for him in the hospital lobby the next evening as he arrived for his shift. "Are you Dr. Chen?" she asked, approaching with a small bouquet of flowers. "Ma'am, you saved my husband's life," she interrupted. "The doctors told me what happened, how you stepped in when no one else could help." Samuel accepted the flowers awkwardly. "I'm glad he's doing well. We have 3 children," Maria continued. "Elena is 8, Miguel is 5, and Sophia just turned 2. They almost lost their father last night." "Mrs. Rodriguez, Maria, please, and I know you don't want recognition or thanks, but I need you to understand something. You didn't just save one life last night, you saved our whole family." Samuel looked at this young mother and saw all the military families he'd encountered over the years, people whose lives were forever changed by split-second decisions made by medical professionals in crisis situations. "Your husband fought hard," Samuel said gently. "He wanted to come home to you and your children. I just helped him do that." "Why do you work as a janitor when you're such a skilled doctor?" It was the question everyone was asking, and Samuel was getting tired of trying to explain something that seemed perfectly logical to him. "Because every job in a hospital matters," he said. "The doctors can't save lives if the floors aren't clean, if the supplies aren't stocked, if the environment isn't maintained. We all serve the same mission, just in different ways." Maria seemed to understand something others had missed. "You're still a doctor, aren't you? You just practice medicine differently now." "Something like that. Well, this doctor saved my family, and we'll never forget that." As Maria walked away, Samuel realized that she'd understood what the hospital administration couldn't. He hadn't stopped being a doctor when he became a janitor. He'd simply found a different way to serve. Chapter 9. Ripple Effects. Over the following weeks, Samuel noticed changes in how the hospital staff interacted with him. The nurses who'd previously barely acknowledged him now stopped to chat about medical cases. Resident doctors asked his opinion on complex procedures. Even the environmental services staff looked at him differently, with a mixture of pride and bewilderment. Dr. Martinez made a point of seeking him out whenever he cleaned the emergency department. "Dr. Chen," she said one night, "I've been reading about the procedure you performed. It's not something most emergency physicians would attempt. In the military, you learn to work with whatever resources and expertise are available. Emergency medicine is about adaptability. Would you be willing to teach some of our residents? Not formally, just share your experience." Samuel considered the request. What would you like them to know? How to recognize conditions that civilian doctors rarely see. How to make decisions when you don't have the usual resources available. How to stay calm when everything is going wrong. "Those aren't medical skills," Samuel said. "Those are life skills that happen to apply to medicine." Exactly. Samuel found himself agreeing to informal teaching sessions during his night shifts. Nothing official, nothing that would change his employment status, just sharing knowledge with young doctors who were eager to learn from someone who'd practiced medicine under conditions they could barely imagine. The sessions became popular among the medical staff. Samuel would finish his cleaning duties, then spend 30 minutes in the emergency department break room, discussing cases and sharing insights from his military experience. "The most important thing," he told a group of residents one night, "is to remember that medical knowledge is only useful if you can apply it when it matters. All the training in the world won't help if you freeze when someone needs you." "How do you stay calm?" asked Dr. Sarah Kim, a first-year resident. "Practice, experience, and understanding that panic doesn't help anyone. The patient needs you to think clearly, not to share their fear." These informal teaching sessions became legendary among the medical staff. Samuel's combination of technical expertise and practical wisdom, gained from years of practicing medicine under extreme conditions, provided insights that weren't taught in medical school. Chapter 10. Full Circle. 6 months after the night that changed everything, Samuel was approached by the hospital's chief of surgery with an unusual request. "Dr. Chen," Dr. Robert Harrison said, "we're hosting a medical conference next month on emergency cardiac procedures. Would you consider presenting on trauma cardiac surgery?" Samuel was replacing a light bulb in the surgical corridor when the request came. "I'm not sure that's appropriate." "Why not? You have more practical experience than most of our attendees." "I'm not a faculty member. I'm not even officially a physician here." "You're someone who saved a life using skills and knowledge that most doctors never acquire. That's exactly what this conference is about, practical emergency medicine." Samuel climbed down from the ladder and considered the request. "What would you want me to discuss?" "Battlefield medicine applications in civilian emergency care, how to improvise when you don't have ideal conditions, how to make life or death decisions quickly." Those aren't medical topics. They're more about mindset and adaptation, which is exactly what our attendees need to hear. Samuel eventually agreed to participate, not as Dr. Samuel Chen, cardiac surgeon, but as Samuel Chen, hospital employee who happened to have relevant experience. The distinction mattered to him, even if it seemed trivial to others. His presentation became one of the most talked-about sessions at the conference. He spoke not about advanced surgical techniques, but about the fundamentals of emergency decision-making, resource management, and staying focused under pressure. Medicine, he told the audience, is ultimately about service. Whether you're performing heart surgery or cleaning floors, the goal is the same: helping people when they need it most. The title doesn't matter. The impact does. After the conference, Samuel returned to his regular duties. He still arrived at 11 p.m. sharp, still methodically cleaned every floor and emptied every trash can, still maintained the same quiet efficiency that had characterized his work for 6 years. But now, when he walked through the emergency department, young doctors nodded respectfully. When he cleaned the surgical corridors, nurses stopped to ask about complex cases. When he restocked supplies, department heads thanked him not just for his maintenance work, but for his contributions to the hospital's medical mission. The patient he had saved, Carlos Rodriguez, recovered completely and returned to work as a construction foreman. Maria sent Samuel a card every month with updates on their family, photos of their children, and simple expressions of gratitude that meant more to him than any medical award he had ever received.
1 year after the emergency that revealed his secret, Samuel was training a new environmental services employee when Dr. Martinez approached with a usual situation. "Dr. Chen," she said, "we have a complex cardiac case in the ED. Dr. Patel is here, but he wanted your opinion before proceeding." Samuel looked at the young employee he was training, a recent immigrant who was working multiple jobs to support his family while learning English. "This is Miguel," Samuel said to Dr. Martinez. "He's new to our team, but he's very dedicated to learning how we maintain the hospital environment." "Nice to meet you, Miguel," Dr. Martinez said, then turned back to Samuel. "About the case." "Miguel," Samuel said, "why don't you continue stocking supplies in the ICU? I'll catch up with you in a few minutes." As the young man walked away, Dr. Martinez asked, "Are you training him in more than janitorial duties?" "I'm teaching him that every job in a hospital is important, that maintaining a clean, safe environment is part of patient care, that service takes many forms. And if he has other interests, other skills, then we'll help him develop them. But first, he needs to understand that there's dignity in every form of work, and that serving others is what matters, not the title on your badge." Dr. Martinez smiled, understanding that Samuel was doing more than training an employee. He was passing on a philosophy of service that had guided his entire career. The cardiac case turned out to be routine, requiring only consultation rather than intervention. But the fact that Dr. Patel had sought Samuel's opinion showed how fully the medical staff had accepted him as a colleague, regardless of his official position. As Samuel returned to his training duties, he reflected on the past year. He'd revealed his medical background, taught dozens of residents and nurses, consulted on complex cases, and even spoken at a medical conference. But he'd also continued to arrive every night at 11 p.m., maintained the same cleaning standards, and found satisfaction in the simple routine of keeping the hospital environment safe and functional. He'd found something that had eluded him during his military career, a perfect balance between using his skills to help others and maintaining the peace of mind that came from a life without constant crisis. As Samuel completed his rounds on that anniversary night, he paused outside the emergency department where everything had changed a year earlier. The night shift was quiet, just routine cases and the usual controlled chaos of a busy hospital. Dr. Martinez waved from the nurses' station, where she was reviewing charts with 2 residents, both of whom had attended Samuel's informal teaching sessions and had become significantly more confident in emergency situations. Miguel, the employee Samuel was training, had proven to be intelligent and dedicated, with a natural aptitude for understanding complex systems. Samuel suspected that Miguel might have other aspirations, possibly in the medical field, but he was ensuring that the young man understood the value of every type of service first. As Samuel completed his rounds on that anniversary night, he paused outside the emergency department where everything had changed a year earlier. The night shift was quiet, just routine cases and the usual controlled chaos of a busy hospital. Dr. Martinez waved from the nurses' station, where she was reviewing charts with 2 residents, both of whom had attended Samuel's informal teaching sessions and had become significantly more confident in emergency situations. Miguel, the employee Samuel was training, had proven to be intelligent and dedicated, with a natural aptitude for understanding complex systems.
Samuel suspected that Miguel might have other aspirations, possibly in the medical field, but he was ensuring that the young man understood the value of every type of service first. At 7 a.m., as his shift ended, Samuel changed from his work clothes into street clothes and prepared to head home. In the locker room, he found a note that had been slipped into his locker. Dr. Chen, thank you for showing us that being a doctor isn't about the position you hold, but about the care you provide. You've made all of us better at what we do. The night shift staff. Samuel smiled and placed the note in his pocket. It joined a growing collection of thank you cards, photos from the Rodriguez family, and informal recognition from colleagues who'd come to understand that true expertise often hides in unexpected places. As Samuel walked to his car, he reflected on the journey that had brought him from military operating rooms to hospital corridors, from life-and-death surgery to quiet service. He thought he was retiring from medicine when he became a janitor. Instead, he'd discovered that medicine, real medicine, the kind that focuses on helping people when they need it most, can be practiced anywhere by anyone willing to serve. Some people serve in dramatic, highly visible ways. Others serve quietly, maintaining the infrastructure that allows dramatic service to happen. The best servants, Samuel had learned, do whatever is needed when it's needed, regardless of whether it matches their job description. Have you ever met someone like Samuel Chen? Someone whose true value was hidden beneath a simple job title? Someone who proved that expertise and dedication can transform any role into meaningful service? Tell us their story in the comments below. And remember, sometimes the most important skills are carried by the people you least expect, working jobs that seem simple but require wisdom, dedication, and the kind of character that puts service above recognition. Thank you for watching Sacrifice Stories. If this story moved you, subscribe to honor more quiet heroes who never stopped serving even when no one knew their true capabilities. We'll see you in the next one. Until then, remember, heroism isn't about the title you hold, it's about what you do when someone needs help and you're the only one who can provide it. Stay humble and stay ready to serve.